living life, having any sense of life. The meds, when they work really well. But yeah, it's just rough doing simple things in life. I can't drive a car. I can't eat food that I want to. I can't go out. I can't go out in public. I can't go to a restaurant. It's so embarrassing. My name is Chris Villarose. There's some guy who caught Parkinson's at a very young age. I like to paint. I like to do a lot of athletics. I was a snowboarder. I'm a golfer. Anything outdoors I really enjoy. So we're talking about the DBS brain implant.
So DBS is like a pacemaker for the brain, and it's mainly for patients with movement disorders. And essentially think of it as the brain circuitry has gone haywire. And the procedure allows us to restore that circuitry.
Basically, there's a line that goes through my body. The right side of me died, the left side's still pretty normal.
DBS is deep brain stimulation, is what it stands for. And what it does is it targets certain areas of the brain that are responsible for some of the side effects that we see with diseases such as Parkinson's.
The first symptoms were a frozen shoulder, where my shoulder froze up, and most people walk with a natural arm swing, and I pretty much walked on one side of my body, so the other side eventually started giving out too. The very first neurologist that saw me said, "You look like you have Parkinson's."
DBS has actually been a procedure that neurosurgeons have been performing for several years, longer than most people think.
Well, it's one of the most fascinating surgeries that we do in neurosurgery, in my opinion. It is one of the most complicated versions because what we're trying to do is insert a recording device, an electrode first. The procedure comes down to precisely placing the electrode within millimeters, because if you don't place it in the right location, it won't be effective.
And there's actually a very good success rate with the procedure itself, especially with patients with Parkinson's and essential tremor. So Chris was sent over by his neurologist due to having to increase his medications, not being as effective as he would like, where it was starting to affect his everyday.
At the point I'm at now, I have no options because the meds just aren't working anymore. I take more and more and they work less and less.
In Mr. Villarosa's case, we did a procedure that's called awake DBS, in a sense that as we place the electrode in, he is awake, but we're listening to the firing pattern of the brain, and different areas of the brain have different firing patterns. And so as we're traversing the brain, different areas, we can actively live listen to the brain's activity.
First stage is done for the lead placement of the DBS system itself. After the battery is placed, that's when we send the patient back over to their neurologist, where neurology takes over kind of full management of the DBS.
I have 2 leads that hook to a battery, and it's stimulating the part of my brain that's dying from Parkinson's.
Once the leads are in their correct spot, we are able to see the patient's tremor, see the patient's rigidity, and test them right then and there in the OR to see if we are in the correct spot. Stage 2 of the procedure usually takes place a few weeks after stage 1, and that is when we take the leads that were placed in the stage 1, we tunnel them down under the skin and attach it to the battery that is used to provide the electrical stimulation to the leads themselves.
But by far, and the most striking situation is, we had Mr. Villarose hold a bottle of water, and we could see the shaking, right? And the stiffness that he has. And we turn on the electrode, and instantly we could see that the symptoms resolved. I can't think of any other procedure that has such an instant visual confirmation that you've helped somebody.
I feel good. I definitely feel a vast improvement over just taking the medication alone.
I believe that deep brain stimulation is an incredibly sophisticated procedure that should be done in academic institutions with surgeons like myself who've done additional fellowship training specifically focusing on deep brain stimulation. The advantage of an academic institution is this multidisciplinary approach, highly trained people who can come together, help something as complicated as Parkinson's disease.
Chris is a great example of the benefit of DBS. He was able to lower some of his medication doses and also not have to take medication as frequently, which is the ultimate goal, and be able to get them back to their daily activities.
But at the end of the day, it is about the patient's symptoms. In particular, you have to make sure the right diagnosis of Parkinson's disease and not other diseases that mimic Parkinson's, because otherwise DBS will not be effective. And the main things that DBS helps with is the tremor and the stiffness and other things too. And it's meant to be an adjunct to the medication as well. It's not a cure, but it has a significant impact on the quality of life.
It's just doing the simple things in life, eating food, taking a walk, petting a pet. I can say where I'm at right this second is light years beyond how I walked in here.
I get so happy every time I see him on my schedule because he is doing so great after he's been able to get back to painting, which is his main income.
And I mean, it's to be able to use my shoulders again, like from what I felt in the operating room and what I just felt when they fine-tuned it, I mean, it's night and day. And this kind of, gives me some, a chance for a normal-ish life. UF Health Jacksonville has been a great hospital and surgical team. Very respectful, and I think it was a wonderful experience.
Yeah, Mr. Villarosa's outcome, though heartwarming and exceptional, it is a standard for us. A lot of patients do not know about DBS, and a lot of times they're scared by the word surgery. But as a matter of fact, this procedure and technology has been around for decades now, and we have tons of experience and research on how to do this safely and effectively.
We have a very close team, including myself, Dr. Tavanapur, our nurse navigators, who patients have direct contact with any questions they have throughout the process, including the preoperative workup, post-operative questions. And there's a direct line of contact for patients to get in contact with either myself or Dr. Tavanapur throughout the entire procedure.